Ed Doolittle, Office of the Healthcare Advocate, and welcome to our Lunch and Learn with OHA, November 15th, 2022. Our topic today is going to be open enrollment in the Medicare programs, that's traditional Medicare and Medicare Advantage, as well as the Obamacare or the ACA open enrollment, the Access Health CT open enrollment. Before we get started, I just want to say a quick word about the Office of the Healthcare Advocate. I sometimes refer to it as the best kept secret in state government. We are a state agency, an independent state agency. We're not part of the governor's administration, but we have a team of nurses, attorneys, paralegals, and others whose main function is to help the residents of Connecticut who are having any type of trouble with their health insurance. And that can be something very simple, from something like not being able to get the billing address on your health insurance changed, and you finally get frustrated and escalate it and you want some help, and we can help with that, on up to a complicated medical necessity denial for a new experimental cancer treatment, and anything in between. Any type of struggles folks are having with their health insurance, be it private insurance they bought on the exchange or that they get through their employer, or Medicare or Medicare Advantage, or Medicaid, which we call Husky in the state. All of it, we have case managers who can advise you and even represent you for free as needed. It's mid-November right now, and that means it is right in the midst of the open enrollment for two of the most key health programs in Connecticut and in the state. Medicare, traditional Medicare and Medicare Advantage, as well as Access Health CT, the Obamacare exchange. So one of our attorneys, Adam Prizio, is on the line. And I see that Denise Ramatar, our Director of Outreach, is on the line as well. So I'm going to turn it over to you guys, but thank you very much for attending this Lunch and Learn.
Thank you, Ted. As Ted said, I'm Adam Prizio. I'm one of the attorneys at the Office of the Healthcare Advocate. And today, if I can remember how to advance the slides, we're going to talk a little bit about open enrollment. We're going to cover the key dates, some of which have already passed, but some of which are upcoming. As Ted said, we're going to go over enrollment both in the Access Health exchange, which is where you can buy the so-called Obamacare or Affordable Care Act plans. We'll talk about Medicare open enrollment, which comes in two phases. I'll talk a little bit about that. We'll talk about some of the information that you want to keep in mind when choosing a plan, and we'll talk about where you can find help, including from our office as well as from other statewide and really statewide resources. So the key dates for open enrollment, we are in the open enrollment periods for Medicare and Access Health right now. The Medicare open enrollment started on October 15th, a month ago, and it goes for another few weeks to December 7th. So if you are Medicare eligible, you should have gotten some information in the mail about that. And you should be aware that this is your opportunity to change plans, to enroll in a Medicare Advantage plan if you want to, or to leave a Medicare Advantage plan and go to original Medicare. We'll talk a little bit about those decisions. The Medicare Advantage open enrollment, so this is a little confusing. There's a second open enrollment period for Medicare Advantage, which is if you are in a Medicare Advantage plan on January 1st, you have the first 3 months of the year to switch to a new plan or to go to original Medicare one time during that period. So if you enroll in a plan and then in that first 3 months you decide, this isn't for me, this isn't working out, I don't like what I've got, I want something different, you can take advantage of that, that open enrollment. As I said, the Access Health Exchange is Connecticut's Obamacare exchange. That open enrollment started at the beginning of November and will go through January 15th, 2023. Folks may also be aware of other open enrollment periods that we're not going to cover in this lecture, or in this lunch and learn. The COBRA election period, which is 60 days following the loss of your employer-sponsored benefits. The open enrollment for your employer-sponsored health coverage, and that can be, at any time during the year. It's not set by law that they have to do it at a particular time. There's also an initial enrollment period for Medicare if you, once you've qualified, and there's a special enrollment period following a qualifying life event for the ACA plans. And we're not really going to talk about those because those are different kinds of enrollment. When choosing a plan, I want to just say this up front. What your health plan is it's protection against unexpected medical expenses, right? That's the idea of health insurance. So you want to think about, when you're choosing coverage, you want to think about what kind of coverage you're going to need. You want to think about your overall health and the overall health of the members of your household that you're buying coverage for. You want to consider if you're aware of significant conditions that you or your household members have that require treatment. You want to think about your risk factors in terms of, do you do things that are risky? Do you skydive? I don't know if skydiving is particularly risky, but do you do things that, if they go wrong, you're going to need additional coverage? Think about what those risk factors are. A lot of people take medication, and medication expenses, as has been in the news recently, the cost of prescription medications is only going up for a lot of these things. So if you take medication, then you need to think of, factor that coverage into your decision making. And then something that we encounter a lot here at our office is that folks think about the premium that they're going to pay every month, and that's it's normal to think about that because that is the thing that you're going to have to pay. So people place a lot of emphasis on that, but it's also important to consider your deductible, the co-pays, the co-insurance, and the out-of-pocket maximum that are offered by each plan that you're considering, because those are costs out of your own pocket too, just like the premiums are. A lot of times people say, well, this isn't covered. I went to the doctor, I had this happen, and they didn't cover it. And what we find out is that they did cover it, but it was applied to your deductible. So that means it was covered. It counts toward your insurance benefit. And when you meet your deductible, your insurance is going to start paying for things. But for now, you have to pay that out of your own pocket. So when you're thinking about, do I get a plan with a higher deductible? Do I focus on my health premiums? It's useful here to consider your prior year's health experience. If you had a lot of hospital visits last year for whatever reason, and you met your deductible, maybe you'll find that it's worthwhile this year to go with a plan with a lower deductible, because you can be confident that you're going to meet it again. With that said, I'll talk now about the ACA open enrollment, which, as I say, is from November 1st to January 15th. You can go to Access Health and you can purchase health coverage for the upcoming calendar year, 2023. There are two carriers on Access Health right now offering coverage. They are Anthem Blue Cross Blue Shield and Connecticut. So you can pick a plan from either of the many plans that those companies offer. You can Also enroll in Husky if you're eligible. So when you go to Access Health and you put in your personal information, it will check and see if your income makes you eligible for Husky, which is the Connecticut Medicaid program. When you purchase health insurance through Access Health, you qualify for the advanced premium tax credit subsidies, which are meant to make health coverage more affordable. And these subsidies during the pandemic have been enhanced by additional congressional money. There had used to be sort of a subsidy cliff where if your income was over a certain amount, if you were $1 over that limit, you got no subsidies, and that meant that folks, and it was folks sort of in the in the lower middle class, right? So working families, you could go from having really affordable coverage to having coverage that suddenly shoots up in price to you. Congress enhanced these subsidies so that there is essentially no subsidy cliff. So the most you will pay is, I should have looked this up, it's something like 8% of your income in premiums, no matter how high your income is. And that is continuing for 2023. You can also review your coverage information that you've had in the past. You can find out more information about your health coverage on Access Health, and you can purchase dental coverage, which is not a part of the ACA, but Access Health is also the exchange to purchase dental coverage. If you sign up before December 15th, your coverage will begin on January 1st. And this is true throughout the year if you're in a special enrollment period as well. If you, for instance, you lose your job, you lose health coverage, and you want to buy coverage off of the exchange, you have to, if you buy it before the 15th of the month, it starts the 1st of the following month. But if you buy it after that, then you have to wait longer. So if you sign up before December 15th, you'll be covered starting in January. And if you sign up after that, you will be covered starting in February. When you're choosing ACA coverage, you'll encounter what are called metal levels. And these, I don't think these were originally intended to be used to advertise the different health plans, but plans do use these names. So the metal levels refer to how much a plan will cover your expected medical costs, right? So a platinum plan is going to cover the most of your expected medical costs during the year. And that's a range of between 86 and 92%. And then a gold plan will cover less, a silver plan will cover less, and a bronze plan will cover still less of what you're expected to pay. So, obviously, if you can afford a plan that, is going to cover more, and certainly if you know that you're a high utilizer, it may be cost effective for you to spend the extra money on a higher metal level, a higher level of coverage. There are people colloquially talk about high deductible health plans, and they mean something that is not always meant by the industry. A high deductible health plan colloquially is a plan with a deductible that is high, right? A deductible that asks you to spend, $5,000, let's say, before, a large amount of money before your coverage kicks in. But there are also what the industry refers to as HDHPs, which are qualified for a health savings account, which is a tax advantaged savings account that you can put money into, you can let the money grow, and you can take it out and spend it on health expenses tax-free. And so particular high deductible health plans you have to be in a particular kind of high deductible health plan, an HSA qualified plan in order to put money into your HSA. So you may see that, you may see those advertised, and you want to consider whether, whether a high deductible plan is right for you, whether you don't expect to have to meet your deductible that year, you have extra money that you can put into an HSA. It's worth thinking about all of those things. Again, as I've said, you want to remember your costs don't include your premium, but they also include your deductible, your co-pays, your co-insurance, and your out-of-pocket maximum. So, when you're focusing on your premium, you're focusing on just the monthly amount that you'll pay for coverage, but you may end up paying significantly more than that if you have a hospitalization or a series of surgeries or something like that. We've talked about the subsidies already. The subsidies remain in effect for the upcoming year. For Medicare open enrollment, you can do a few things during the Medicare open enrollment period, which goes through December 7th. You can change from original Medicare to a Medicare Advantage plan. You can change from a Medicare Advantage plan back to original Medicare. You can switch from one Medicare Advantage plan to another Medicare Advantage plan. And you can also add, change, or remove drug coverage, both with original Medicare and with Advantage plans. So those are all of your options, and whatever you elect during this open enrollment, your coverage will start on January 1st. When you're choosing Medicare coverage, I like to sort of disambiguate a little bit what the difference is, because people, there are a lot of letters, there are a lot of different, the word plan gets used a lot to mean different things. When we say original Medicare, what we mean is Medicare Parts A and B. Part A, and this is a simplification, but Part A generally covers hospitalizations, where Part B covers more of your, outpatient medical expenses. Original Medicare can be used with any doctor who takes Medicare. If you're enrolled in original Medicare, you can buy supplemental coverage, what's called Medigap coverage, which provides assistance with your 20% share of costs. So original Medicare pays 80% of covered services, and then you pay 20%. But 20% of a large amount of money is also maybe a large amount of money. So folks can enroll in supplemental coverage to assist with that 20% share. And they can also buy Part D drug coverage for prescription drugs. There is no coverage under original Medicare for dental, vision, or hearing. I'm trying to remember. I know that there was political talk about adding hearing to Medicare, but I don't believe that was in effect for the coming year. I think that's in 2024. If anyone has questions about that and wants to leave their contact information, I can get back to them. If you're in original Medicare, you can qualify for extra help through something called the Medicare Savings Program, which can help you with your Part B premium. It can help you with your other costs, and it can cap your costs. Extra help is income-based, so you'll have to provide your income, and if your income is below a certain level, you get the extra help. Now, if you don't enroll in Part B or Part D, there's a penalty, and you can avoid that penalty if you have other qualifying coverage, which is typically coverage from your employer or your spouse's employer. But when you lose that coverage, if you retire, your spouse retires, you start a clock ticking, and there's a penalty for however long you are not enrolled in Part B and Part D. There's a penalty that grows and cannot be gotten rid of. So if you have any questions about, I'm eligible for Part D, but I'm not enrolled, and I'm concerned about this penalty, you should call Choices and talk to them about it. And I'll get into a little bit what Choices is and how to contact them. Oh, excuse me. Medicare Advantage coverage is private insurance coverage that provides the same benefits as Part A and Part B, original Medicare. But instead of using the network of all the doctors and hospitals that take Medicare, they use the plans network, the network for instance, United Healthcare or Anthem or Connecticut. They use that network for non-emergency care. And that network may include your doctors and it may not. So you wanna learn about the network. They may include drug coverage, and they may include dental, vision, hearing, and additional benefits, right? So in some states, not in Connecticut, I believe, but in some states there are, for instance, fitness benefits that Medicare Advantage plans offer, where people get a discount on a gym membership through their Medicare Advantage plan. And these have a yearly out-of-pocket maximum that is capped, and I don't remember what the maximum is this year. I want to say it's $6,700, but if anyone has questions about that, as I say, I don't remember off the top of my head. Where can I get help? If you have additional questions, this is a pretty quick and simplified overview of open enrollment. Your specific situation may be different. You have specific questions about like the drugs you take or the people in your household or things like that. You can contact our office. You can go to ct.gov/OHA. You can call 866-466-4446, and we will be happy to take your question, do some research if we don't know, and get back to you with either an answer or further places to go for help. Some of those other places will include for ACA plans, you can call Access Health. They have trained folks who pick up the phone and answer emails and can give you advice about or give you answers about health insurance on the exchange. You can also talk to an insurance broker who can assist you with getting an ACA plan through the exchange. If you have questions about Medicare and Medicare Advantage, I always recommend that people call Choices, which is Connecticut's state health insurance assistance program. They have trained volunteers answering the phones, talking about Medicare Advantage for free. They provide unbiased advice. They get funded by the federal government just to answer questions. And they can, you can go to them, you can call them up with a list of the medications that you take, and they can help you find the Part D plan that will, be right for you. Their number is 800-994-9422. I think I see a question in the chat. Denise has also put our email address in the chat, which is healthcare.advocate@ct.gov. Thank you, Denise. I should have put that on the slide. And that is the end of my presentation. I'm happy to answer questions if folks have any questions. Do I know, there's a question in the chat. Do you know if the HSAs can be used to put aside money to pay for providers that don't take insurance, to pay out-of-pocket costs? For instance, my naturopathic physician doesn't participate with any insurance companies for various reasons. That, off the top of my head, I don't, Constance. I know that there's a sort of the IRS has a list of the things that you can spend your HSA money on without incurring a tax, right? The authorized HSA expenses. They can pay for out-of-network care. Thank you, Ted. I don't know if, and I think I was getting pulled off by the question of holistic and naturopathic medicine. I don't know if holistic and naturopathic providers can be count for the IRS's purposes, but HSAs can pay for out-of-network care. Are there other questions? All right, seeing no other questions, I want to thank everybody again for coming and encourage you to tune in again next month when we will be talking about the difference between self-insured employer-based coverage and fully insured coverage and the different ways that the state regulates the one versus the federal government regulates the other, and how that affects you as an employee who's enrolled in health coverage through your employer.
Thank you, Adam.
Thank you.
Bye, everyone. Have a great day.